Findings in a new study by The Lancet point to a big issue. People are underreporting how much they drink, which can lead to the discovery of alcohol use disorder a little too late. Joining us now to break it all down is 9 News medical expert, Dr. Payal Kohli. Welcome.
Hi, Dr. Kohli. So first and foremost, why would you think that? I mean, you think about alcohol. It is so embedded into our society, the social systems. Like, why do you think that is?
It's a substance that causes cancer, causes dementia, causes heart disease, and yet we choose to use it. So if you trace back to the history of alcohol, 7,000 to 9,000 years ago, first reported in China, and it was actually safer than the drinking water. And that's part of how people started to use it. Then it became embedded into our ritual cultures, like religious things and celebrations, communions, and things like that. And now if you think about alcohol, what it represents romance, it represents celebration, it represents friendship, it represents mourning, socialization. So it's really every part of our life has become based on alcohol, sporting events and parties and holiday parties. And so it's really hard to separate it, which is how we're seeing our young people getting so caught up in drinking more alcohol than they should.
It's so true, because you drink when you're happy and you drink when you're sad. It's like literally for every emotion in the book. And because that's the case, like, how do you even screen this? How do you know as a medical, provider when somebody's gone too far?
Well, this study was a little eye-opening for me because I think we had it wrong. So what we were doing was a questionnaire called the CAGE questionnaire, C-A-G-E. So CAGE is cutting down. Have you ever thought about cutting down? A, anger or annoyed. Do you ever get angry or annoyed when somebody tells you to cut down? G is guilt. Do you feel guilty about your drinking? And E is eye-opener. Do you ever drink something like a mimosa or something in the morning just to get your day started or to help you get over a hangover? Now, the problem with the CAGE questionnaire, it works really well if you're addicted to alcohol. You already have alcohol abuse. But more commonly, what we see is binge drinking, these weekend warriors, and CAGE doesn't pick that up. So really what we should be doing now is in the last year, how many days have you had more than 4 drinks for women or 5 drinks for men? And if the answer is more than 0, then that's a positive screen. We need to look further in one occasion.
And then what did this study tell us? I know that there was some sort of link with excess drinking and obesity. Is that correct?
Okay, so 40% of Americans are considered obese, right? And we know that fatty liver, which is a direct consequence of obesity where fat deposits onto the liver, has nearly doubled since 1980. So this looked to say, okay, alcohol is metabolized through the liver. Does that give you a double whammy? And in fact, if you're one of those obese Americans or even someone who just has fatty liver without being obese and you drink alcohol, your risk of dying from alcohol is incredibly high. And so that means a lot of young people out there, especially I'm thinking sort of you have a little bit of a beer belly, you're watching a sporting event, you like to drink a little bit on the weekends, you're not that active, that is a setup for leading to a significant problem later in life.
Any, hopefulness on the horizon when you think of Gen Z? They don't drink as much as, elder millennials and beyond.
I love this trend. You know how people are saying, let's not do drinks, let's go dry forever. And I think that has really caught on, and I'm hoping that it continues to stick. Now, I'm hoping they don't replace it with energy drinks and sugary drinks, because that's switching one poison really for another. But I am very hopeful that as we raise awareness of this, especially with all the preventable cancers related to alcohol, colorectal cancer, pancreatic, esophageal, breast, liver, all being high, preventable alcohol-related cancers, people are going to start taking control of their health. And I do think it's really up to family members to lower the stigma. So if you do notice that someone tends to drink when they're happy, when they're sad, when they want to relax, more than they should, you need to say something. You cannot just, for your own comfort level, look the other way, because doctors are missing it. And in fact, nearly half of patients presenting to the ER were diagnosed with alcohol use disorder. So we didn't pick it up in screening. We picked it up when they got a DUI, when they got so intoxicated, or they hurt themselves.
Important information, Dr. Kohli. Thank you.